Welcome back to Living at Weight, and we are joined now in the Living at Weight Lounge by Martha Clopin, the Managing Director at Get to Insurance. Thank you so much for being here. We really appreciate it, as always.
Thank you for having me, John.
We are talking today about some important news. As the pandemic comes to an end, so does some benefits that might scare a few people, but we've got some info for them. Can you tell us a little bit about who's at risk at losing their Medicaid benefits?
John, we have over 450,000 people here with Medicaid, so about 15% are anticipated to lose this Medicaid coverage. That would be about 66,000 people.
When will they be notified that those benefits are going to end?
Well, they're supposed to get notified 60 days ahead. So July 15th was the first date, but that has been changed. So we're thinking it's going to happen sometime this fall. People should prepare by looking at the mail. Sometimes people don't want to open mail, but in the mail you'll have what's called a redetermination letter. You need to complete that and get it back to the state Medicaid office, and that will ensure if you still qualify, you'll be able to maintain those benefits.
What are some of the special challenges that are faced by local residents with Medicare and even Medicaid?
Right. What happens is a lot of people change their address and they don't let the state know, so then you can't get the letter. And unfortunately, if you're not able to complete the redetermination request, you could lose those very, very valuable benefits. So sometimes people have difficulty because they don't check the mail, they change their address. So what we've been told to do, those of us that partner with Centers for Medicare and Medicaid, is to get the word out. Tell people, start checking their mail for a notice about redetermination for your Medicaid benefits this fall.
Could you introduce our next guest? We're going to zoom in with Scott. Tell us a little about him.
Scott Flazer is an independent agent, and he's the person that people with Medicare and Medicaid can talk to if they find that they've lost their Medicaid eligibility and they need to look for a plan that doesn't require you to have Medicaid. So Scott's been in the business for over a decade. He used to work with several local health insurance companies, and as an independent, he can help people get straightened out.
All right, Martha, let's dial in with Scott real quick. Scott, thanks for being with us. Appreciate it. I want to know from you what some of the challenges faced by local residents are with Medicaid and Medicare.
Well, first of all, I do enjoy working with the underserved population. They're very appreciative to the help that we give them and seem to recognize genuine people. But sometimes they may be on medication, and if there's an interruption in their insurance, it could be life-threatening. If they're receiving dialysis, for example, or other expensive treatments, to lose coverage and not pick up a replacement coverage could lead to bankruptcy, houselessness, and worse.
How can your team help people when the time comes to replace a plan due to the loss of Medicaid eligibility?
Great question. We have tools to analyze, quote, and assist with replacement plans quickly and easily. Since October of 2020, we have helped over 3,000 people, Hawaii residents, with the healthcare.gov marketplace plans, as well as Medicare education as a free community service.
All right, great information from Scott. And if somebody out there wants more information from you, how do we get a hold of you?
Yes, you can always go to gettoinsurance.com to learn more about the services that we offer, but we're really here for the community to work on these things that sometimes it's not easy to find answers to. So we don't want any surprises. We want everyone to stay insured.
Thank you so much again for being here. We really appreciate it, and we'll have much more on Living at Weight when we continue.